Hi, Jen.
Hi.
My name's Elisa. I'm going to be your occupational therapy student.
Hi, nice to meet you.
Nice to meet you too. How are you doing today?
I'm doing okay. I'm feeling a little down, just because my hands kind of hurt from my scleroderma, and it's hard for me to do things like I used to. So yeah, feeling a little sad about it.
Yeah, that must be really frustrating. Well, you're in the right place. We're here to help you as occupational therapists. We're going to get you back to the activities that you need to do.
Okay.
So before we get started, are you in any pain?
Yeah, actually my hands both hurt.
Yeah, on a scale of 1 to 10, 1 being the most pain, and 10 being the most pain, how much pain would you say you're in?
They're both about a 5 right now.
About a 5?
Yeah.
Okay. So we're going to start with this heat modality called paraffin. It's just hot wax, and that's going to help reduce some of the pain that you're feeling and increase some of the range in your hands, so increase the extensibility before we do an activity, okay?
Okay, that sounds good.
All right, let's go. Now that you washed your hands and you've taken off all your jewelry, we're ready to use the paraffin.
Okay.
Okay, so what you're gonna do is you're gonna dip your hand in all the way.
Okay.
And then bring your hand out.
Okay.
Perfect, just like that. Now bring it out.
Uh-huh.
Let it dry for a few seconds and
Okay.
then dip it back in.
Okay. Ooh, that feels nice and warm.
Yeah, I know it's very
And do I just do
therapeutic.
this? How many times do I want
You're
to
gonna do this for a total of 6 times.
Okay, so
The paraffin's going to be on for about 15 minutes. In the meantime, I just want to chat with you a little bit to get to know you better.
okay.
So can you tell me a little bit about what you've been having difficulty with in your daily life?
Well, in the morning, especially when I wake up, I like to brush my teeth. So it's really hard for me to hold the handle of the toothbrush, just because like my fingers hurt and I can't like squeeze the handle. So I'm really struggling with that. And then also putting on makeup in the morning has been hard.
Makeup too?
Yeah.
Okay. So we have this built-up handle that we can use that can make the activity a lot easier for you.
Okay.
So it's just like foam. It looks like this. And what you can do is, since we have your toothbrush here, we're going to try it out on your toothbrush first. You can use this on your toothbrush. You can also put this on your makeup handles, and you can get it on Amazon in different shapes
Okay.
and sizes, okay? So we're gonna go ahead and put the toothbrush in. Okay, so this is gonna help because it's gonna take some of the, it's actually gonna use a larger grip, so you're not gonna,
Okay.
you know, have like that small grip going when you're brushing your teeth. And that should help with some of the difficulties you're experiencing. Now that we took the paraffin off, what's your pain level like after?
It's actually a lot better. It's like a 1 right
A
now.
1?
Yeah,
Oh,
I
that's great.
barely feel any pain.
Okay, perfect. So now that you have less pain, let's go ahead and try to brush your teeth with the built-up handle.
Okay.
So I just want you to brush your teeth like you normally would.
Oh yeah, that feels better. Okay.
How's that?
It was good. It was a lot easier to hold the handle with the built-up foam on it.
Okay, good. So we're done for the day, but to finish it off, I'm just gonna give you a couple exercises that you could do in the mornings to relieve some of your stress.
Okay, Jen, so I know you've been having some difficulties out in the community with managing your Raynaud's. Can you tell me more about that? Where or what are you having difficulties the most with?
So me and my friends, we like to go out, especially we like to go out dining, to fancy dinners or brunch, and it's just been really hard for me to tag along with them just because a lot of times my hands get so cold and like I have to leave, and that's really uncomfortable for me. And also I usually like my drinks on the rocks, or just I like to drink soda with ice, and the cups can get really cold for me to hold, so
Yeah.
I constantly have to order like hot coffee or tea, and I hate tea, so it's
Yeah.
just it's not fun for me.
Yeah, no, I understand. Well, there's definitely some things that you can do to help you when you're eating out. First thing is making sure you're prepared. So make sure to wear layers anywhere you go, so that you always have a jacket with you in case it is too cold in the restaurant.
Okay.
Also, for the colder drinks, you are able to get colder drinks. Just ask for them in a mug, so that you don't have to touch the glass directly. You can just hold on to the handle, and that usually is not cold.
It's a good idea.
You can also do gloves, but I know sometimes, depending on what you're wearing, you might not want to wear gloves. If you have the Raynaud's, then you usually just leave.
Yeah, I usually just leave, so I'm open to trying those things, those suggestions, but if any of those don't work, is there anything else I can do?
Yeah, there's actually a few things that you can do to prevent the Raynaud's if you feel like it's getting cold, or once it happens, to help with the Raynaud's. So why don't we go to the dining room and then I'll show you those.
Okay.
I wanted to mention to you as well, before you get seated at the restaurant, you can also ask the hostess if you can get seated somewhere away from the air vents, so a warmer area of the restaurant. And so you can kind of prevent your Raynaud's from flaring up. But sometimes, like you said, sometimes we're not able to do those things, or it's still your Raynaud's still happens.
Yeah.
So what you can do is, to prevent it from happening, you can use, or if you feel it happening, you can use your body heat to warm up your fingertips. So you can put your hands under your arms like this. Or you can put your hands under your sit on your hands basically.
Oh, I see.
Yeah, so you can do that to warm up your hands and to prevent it from happening. Do you prefer any of those methods?
I think I like this.
Yeah.
Yeah, and
it looks more natural.
yeah,
too.
exactly. Yeah, I like this method. I can use this for sure.
Good. But if your Raynaud's does occur, then you can also use. If you have a restroom available to you, you can use a sink and run your hands under some warm water, and that should settle down your Raynaud's. And then the last technique I want to show you, you don't need a sink. It looks a little bit funny, but I'm sure your friends will be understanding, and once they get to know more about your Raynaud's. So it's called the swing arm technique. And you're basically just gonna swing your arms and get more blood flow to your fingertips. So you're just gonna do this.
Okay.
I know, it looks a little funny. So why don't you try it? There you go. And then you're basically just gonna do this so that you can get some more blood flow to your fingertips.
Okay, yeah,
Okay.
I can do that.
Do you
My friends can get a good laugh at it.
Yeah.
Yeah.
Do you see yourself using some of these techniques?
Yeah, definitely. I think these are all really good techniques I didn't know about. Like,
Good.
just simple things that I can request to
Yeah.
just make my life easier.
Good.
Especially with the cups. Like, that was
Oh, yes.
just holding the cup was really hard for me, so I think this is really good.
And we'll definitely follow up, and I want to see.
Okay, Jen, so I know that cooking is an activity that's really important for you, and you told me that you had been struggling with it recently.
Yeah, and I'm having difficulty with cooking, and like I'm not able to cook when my daughter's over when she visits, and I look forward to making her food when she comes over, and I just can't do that right now. I'm having a hard time.
Yeah, I
So
understand.
I really want to get back to doing that.
And I want you to get back to it too. So today we're actually going to focus on helping you get back to cooking again. We're going to start off, I'm going to show you some joint protection strategies.
Okay.
And then, did you bring all this stuff to make your salad today for lunch?
Yeah, I brought it from the bag.
Okay, great. So, and then we'll make a salad and you can take that home for you to eat at lunch.
Okay, sounds good.
Okay. So just joint protection strategies, I don't know if you've ever heard of them, but they're just going to help reduce your pain, reduce your fatigue, and then help to put less stress on your joints.
Okay.
So just some little things is for heavy objects, instead of picking them up like you normally would and carrying them, you want to just try sliding them across the counter. So do you want to try that?
Yeah. So just this?
Yeah. Slide like that. And then also if you're holding like a tea kettle in the morning, that was great. Or even a cup of coffee, instead of gripping it like this by the handle, you want to just try using both hands
Okay.
to carry them. So just using larger joints instead of the small ones, if you want to just try that too.
Oh yeah, that's easier.
Yeah, it's a lot less stress on your joints.
Okay.
And then you want to also maintain proper body mechanics. So if you're reaching for something that's lower in the shelf, you want to make sure to bend your knees and keep your back straight to grab it. Don't bend forward. So if you want to just try that.
Yeah.
Keep your back straight.
That's
Good, yes. And that was actually perfect.
Okay,
Good technique. And then also another little tip for the fridge is instead of gripping it with your hand, you can put your forearm here in the space and then just pull it like that.
Okay.
And then also
Can I try that?
Yeah, try it. That'll put less stress on your joints. So the whole purpose is just to use larger joints instead of the smaller ones. And also if you're ever feeling fatigued, just take rest breaks.
Okay.
And if you're feeling pain, stop whatever you're doing, okay?
Okay. Yeah, those were pretty easy to do. I think I could use those.
I have some of the materials that you brought that you wanted to put into your salad. So to make it easier for you to cut up your vegetables, we have a couple options, some adaptive equipment. The first one is just a normal knife that's put into the built-up foam. So this is going to make it easier for you to grasp, and then you can just use it to cut up your cucumber and your tomato and all your other supplies if you want to just see how that feels real quick.
Oh, that makes it a lot easier.
Yeah, it's a lot easier to grip and it won't be as painful on your joints. So that's one option for you.
Okay.
And then the other option is this rocker knife. So how you use this is, it also has built-up handle, but you can just use it to just go like this and cut the cucumber or whatever vegetables you're working with.
Okay.
So if you want to see how that feels.
Oh.
So these should make it easier for you to chop up your salad, and then we can also reduce your pain.
Okay.
Okay.
Yeah, this makes it a lot easier.
Now you have your salad with you. That's the end of our session. You can take this home and go enjoy it home, and it's really nice that you got to make it on your own.
Yeah, I'm excited. It looks delicious.
It looks great. And then I also gave you the joint protection strategies worksheet, so you can just remember all the strategies we used. And also you can use those not only when you're cooking and preparing food, but when you're doing tasks at home or any other activities throughout the day. It'll also help you with your pain. Okay?
Yeah, I'm definitely going to use those. Thank you for teaching me.
You're welcome. So
Well,
we'll see you next week.
Yeah, have a good day.
Okay, enjoy that salad.